Hello and welcome to my YouTube channel, AnatomyMentor. Today, I'll be discussing a very important topic of neuroanatomy, which is the thalamus. Now, the thalamus is a part of the forebrain, and this is a very important neuroanatomical structure that helps us in processing information, emotions, forming memories, storing memories, and this thalamus is present at the upper part of our brainstem. So in today's lecture topic, I will be discussing a brief summary of the structure and functions of the thalamus. And today, the learning objectives are that we shall talk about the components of diencephalon and the location, general appearance, and subdivisions of the thalamus. Also, I shall discuss the connections and functions of the different nuclear groups present within the thalamus. Also, the role of the thalamus in information processing and the types of information that it deals with. And in the end, a brief clinical account of the important thalamic lesions. So this is what we shall be talking about today. Starting with the topic, first you should be familiar with diencephalon. What is diencephalon? Well, diencephalon is a part of our forebrain. And when we talk about the diencephalon, remember, it is the central core of the cerebrum. So it is covered on the upper and outer aspects by the two large cerebral hemispheres. The diencephalon itself is present hidden under these hemispheres, so only the ventral surface, that is the lower surface, is exposed to view. And laterally, it is bound by the internal capsule. Now, the slit-like third ventricle separates this diencephalon into two symmetrical parts, except in the region of the interthalamic adhesion, where the medial surfaces of the thalami may be in communication or continuity, and this interthalamic connection is present in 70% of the population. Now, when we talk about the diencephalon, remember the junction of our midbrain and diencephalon is represented by a line that passes through the posterior commissure and lies immediately caudal to the mammillary body. Whereas the boundary of the diencephalon and the telencephalon, which is the most cranial part of the forebrain, is represented by a line that traverses the interventricular foramen and optic chiasma. So over here, you can see this is a sagittal section through the brain and the upper aspect of the brainstem. And here is the region of the diencephalon. To be more specific, this is the region of the thalamus. And here you can see that the boundary, which is between this diencephalon and the midbrain, is represented by a line that passes from this posterior commissure to the mammillary body. And let's look at the upper part or upper extent of this diencephalon, where the line is passing through the interventricular foramen, separating it from these cerebral hemispheres above. Now, the diencephalon itself is subdivided by the hypothalamic sulcus into two major parts. The dorsal part is known as the pars dorsalis. This is the one which consists of the thalamus, the metathalamus, and epithalamus. Remember, the thalamus, which we say loosely thalamus, is actually the dorsal thalamus. The ventral part is the pars ventralis, and that consists of the hypothalamus and subthalamus, which is now the ventral thalamus. So here is a sagittal section through the brain, and we can see that this is the area of the diencephalon, and this dotted line represents the hypothalamic sulcus, which is dividing this area into the pars dorsalis above and the pars ventralis below. So as I mentioned, the pars dorsalis is the area which contains our thalamus, and here you can see is the interthalamic adhesion, which I told you is present in 70% of the population. Below the hypothalamic sulcus is this area, pars ventralis, which contains the hypothalamus. So the pars dorsalis, which is the part above the hypothalamic sulcus, consists of thalamus, metathalamus, and epithalamus. And we are going to look at the thalamus in detail today, We shall find out which nuclear groups are present within this large mass of gray matter. The metathalamus, remember, includes the medial and lateral geniculate bodies, while the epithalamus is the pineal gland and habelunar nucleus. When we talk about the pars ventralis, that is the part of diencephalon below the hypothalamic sulcus, it consists of hypothalamus and the ventral thalamus. The hypothalamus itself has different nuclei, whereas the ventral or subthalamus is the zona incerta and subthalamic nuclei. So here in this simple diagram of the sagittal section of the brain, we can see that this is the area of the diencephalon. Here is the thalamus and the interthalamic adhesion. And then you also have the hypothalamus. And posteriorly, you can see the habenular commissure and the pineal gland, which are the epithalamus. Okay, now let's come specifically to our topic of discussion, which is the thalamus. Where is it located and what is its gross appearance? Well, remember, the thalamus itself is a word of Greek origin, which means inner chamber. And why is it called inner chamber? That is because it is the center where processing of information is taking place, where the different types of information are entering, and then they are further going to be relayed over here to the cerebral cortex. The largest component of diencephalon is the thalamus, and it is lying, like I told you before, at the upper end, that is the rostral end of the brainstem. There are two thalami, one on each side of the third ventricle. Now, each thalamus itself is an oval-shaped mass of gray matter about 3 centimeters long and 1.5 centimeters wide, and it is subdivided into many nuclei. So here we can see in this three-dimensional diagram, this is the thalamus, and it is covered by the cerebral hemispheres, and it is an egg-shaped mass of gray matter. And you can see over here from in front, that there are two thalami, and they are connected by this here interthalamic connection or adhesion. So each thalamus has an anterior end and a posterior end. The anterior end is narrow, while the posterior end is narrow, and it forms the posterior boundary of the interventricular foramen. Whereas the posterior end is broad, and that is known as the pulvinar. And remember, the posterior end, that is the pulvinar of the thalamus, overhangs the superior colliculi. So here is a posterior view of the brainstem, which is showing us the thalamus. So here, if you follow the laser pointer, you can see these are the paired thalami, and their posterior end, which is shown over here, that is the pulvinar. It partially overhangs this area of the brainstem, that is the uppermost part of the brainstem, which is the midbrain, and here are the superior colliculi. Now we are going to look at the functions of the thalamus. So here I'm going to discuss the functions of the thalamus. And for that, I'm going to draw the thalamus over here. So like I told you, this is an egg-shaped mass of gray matter with a narrow anterior end and a broader posterior end. So the thalamus word literally means inner chamber. So it's called the inner chamber because it is going to receive the information from the different parts of the body, and this information, it is going to be processed within the thalamus. So that is why it is also known as a relay station. So remember, the thalamus is a relay station. Now, what are the different types of information which are entering the thalamus? Well, first of all, the sort of information which enters the thalamus is the sensory information. Now, this sensory information can be tactile, that is the sense of touch. It can be vibratory. It can be gustatory, that is the taste sensations. It can also be pain, or temperature sensations, right? And also the auditory and visual stimuli. So there are the different sensory information which is coming into this thalamus over here. And remember, there are different tracts within the spinal cord which are bringing this information, like the tactile and the vibratory sensations are brought by the dorsal column medial lemniscal system, whereas gustatory sensations are brought by the trigeminal lemniscus. Pain and temperature sensations are being conveyed by the spinal lemniscus. Now let's look at the other type of information, which is the motor information. And this is entering the thalamus from the basal ganglia, which are the masses of gray matter lying under cover of cerebral hemispheres, and also the cerebellum. Then the information which is entering the thalamus is also the information which is going to enter from our limbic system. The limbic system consists of different structures, notably the hypothalamus, the hippocampus, and also the amygdala are some of the structures which are going to bring information to the thalamus. And we also know that we have information which is going to be the information which is coming from the reticular formation. Now, reticular formation is the group of neurons which is present within the brainstem. And this is information which is going to be processed within the thalamus, and it is related to the sleep and wakefulness cycles, or we could say our level of consciousness, right? So this information is also going to enter our thalamus. Now, what thalamus does is that it processes the information first, and then it conveys the information to the cerebral cortex. So this information is going to be conveyed to the cerebral cortex. And remember, this is a bidirectional relationship. The cerebral cortex itself will also be sending information back to the thalamus and influencing the action of the thalamic nuclei. So this is a summary, or this is an overview of the functions of the thalamus. Now, coming back to our presentation, now that we have discussed these functions, I'm going to summarize them once more. Over here, we can see that the functions of thalamus are three. The first one is that it is a major sensory relay for the ascending tactile, visual, auditory, and gustatory information, which ultimately reaches the neocortex. Second, you could see that the motor control areas such as basal ganglia and cerebellum, they also synapse in thalamic nuclei before they reach their cortical destinations. Other thalamic nuclei, they participate in regulation of the states of consciousness. So these are the three basic functions of the thalamus that you can see over here. That is sensory relay and motor and limbic relay and the wakefulness. So just remember this triangle and remember the three components of this triangle, which will help you keep in mind the functions of the thalamus. Okay, so now I am going to discuss the different nuclei of the thalamus. And for that, as you can see over here is the whiteboard. And over here for the orientation is the compass, which is showing the direction, which is the anterior direction, the posterior direction, and the medial and lateral directions. So this here is our right thalamus that I have drawn for you. And now we're going to be looking at the nuclei first, which are present within the thalamus. Remember, the thalamus itself is a mass of gray matter. It is covered on the superior aspect by a sheet of white matter known as stratum zonale. Also on its lateral surface, there is a sheet of white matter, which is known as the external medullary lamina. Okay, and now within the thalamus, there is also a sheet of white matter, which is known as the internal medullary lamina. So here, remember this is a vertical sheet, but since this diagram is representing a section, you could say a transverse or cross section through the thalamus, we're going to look at the appearance of this internal medullary lamina that is in the shape of the letter Y. This internal medullary lamina is the sheet of white matter which subdivides the thalamus into three main parts. Now, you can see that this is the anterior aspect. So over here, there are the two limbs of this internal medullary lamina, and the area that they enclose, this area is known as the anterior nucleus of the thalamus. Whereas the stem of this Y-shaped internal medullary lamina, this subdivides the thalamus into a medial part and a larger lateral part. The medial region, this is known as the dorsomedial nucleus of the thalamus. Whereas this larger part over here is now the lateral region, and it is subdivided into different nuclei. So you can say that it is further subdivided into two main parts, which are the ventral tier and the dorsal tier. The ventral tier consists of the VA, that is ventro-anterior nucleus, and the VL, which is the ventrolateral nucleus. Also, it consists of the VPL, which is ventral posterolateral nucleus, and the VPM, which is ventral posteromedial nucleus. Posteriorly are the lateral and medial geniculate bodies. This is the lateral, and here we're going to draw the medial geniculate bodies. The remaining portion, that is the dorsal tier, is subdivided into an LD, that is lateral dorsal nucleus, LP, that is the lateral posterior nucleus, and then the rounded posterior portion of the thalamus, which is known as the pulvinar. So these are the subdivisions of the gray matter of the thalamus into these nuclei, or we can say these are the nuclear masses or the thalamic nuclei. Now, if we want to look at the functions of these different nuclei of the thalamus, well, I'm going to do this in a very simple color-coded way, so that would be easier for you to remember and understand the functions. Well, the anterior nucleus, which I'm giving a shade of purple, as well as the nucleus, which is over here, the dorsomedial nucleus. These are along with the LD, that is the lateral dorsal nucleus. These are the areas which have the function that is concerned with the limbic system. So their connections are mainly with the limbic system, which includes the Papez circuit, and that includes different parts of the brain like the cingulate gyrus, the amygdala, and the hippocampus. So they have bidirectional connections with these different parts of the limbic system. And dorsomedial nucleus also has connections with the prefrontal cortex. Now, let's look at the other nuclei. The VA, that is the shading in red, ventro-anterior and ventrolateral nuclei. These are the ones which have their connections with the basal ganglia and the cerebellum. So their function is mainly associated with the processing of the motor information which is coming to the thalamus, right? Now let's look at the other nuclei. We have the ventroposterolateral nucleus. This is the one which is receiving the sensory information, that is the tactile and vibratory information from the dorsal column medial lemniscal system, and it is also receiving the pain and temperature sensations from the spinal lemniscus. So this is the function of the VPL. And if we look at the VPM, that is ventroposteromedial nucleus, this is the one which is receiving information, or the gustatory information, from the trigeminal lemniscus. And let's look at these lateral and medial geniculate bodies. Well, the lateral geniculate body, this has the information which is coming from, it is receiving information from optic tract, and then it is sending the information to the visual cortex. Whereas medial geniculate body receives information from the inferior colliculus and sends it to the auditory cortex. Remember, the VPL and VPM are going to send the information to the sensory cortex, that is in the parietal lobe, whereas VA and VL nuclei, which are processing motor information, are going to send this information to the motor areas of the cerebral cortex, that is the precentral gyri, the primary and the secondary motor areas. Whereas the remaining parts of the thalamus, which are the LP and the pulvinar, remember, they have intrinsic functions, that is the processing of information amongst the different thalamic nuclei, right? Also, let's look at the other function of the thalamus. If we recall, we mentioned the function which is related to the sleep and wakefulness. Well, for that, remember that the area which is known as the interthalamic adhesion, which is present on the medial aspect of thalamus, it consists of several nuclei or neurons, and also the nuclei are present over here in the internal medullary lamina. The ones present in internal medullary lamina are known as intralaminar nuclei, and the ones present over here in the interthalamic adhesion are known as the midline nuclei. Well, these are the ones which are receiving information from the reticular formation of the brainstem, and they have this bidirectional communication with the cerebral cortex, and their function is related to sleep and wakefulness. Also remember, the reticular nucleus is present on the outer aspect of the external medullary lamina, and this here reticular nucleus, it is receiving information from the reticular formation. This here is the reticular nucleus. It is receiving information from the reticular formation. So it is also concerned with the levels of consciousness. So this is a summary of the nuclei in the thalamus. And I also mentioned the connections of the thalamus. And now we're going to go back to our PowerPoint presentation, and we're going to summarize what we have just discussed. Okay, so going back to our presentation, you can see over here, we have these thalamic nuclei, the ones I just drew for you on the whiteboard. Now you can see it as a three-dimensional representation, the subdivisions of the thalamus. This here is the posterior aspect of the thalamus with the pulvinar and the geniculate bodies. And this here is the rest of the thalamus. You can see the Y-shaped vertical sheet of white matter, which is the internal medullary lamina, dividing it into three separate larger portions. The anterior nucleus present between the two limbs of the Y, the dorsomedial nucleus present on the medial aspect of the stem of the Y, and on the lateral aspect, we have the ventral and dorsal tears. And on the outer aspect, on the lateral side, is the reticular nucleus over here. Also on the medial aspect, you can see the interthalamic connection and the nuclei of the midline. This is another way of summarizing the nuclei of the thalamus. So I really like this method of summarizing the nuclei, because you can see thalamus is divided into these three major parts. The gray matter is divided into anterior, medial, and lateral parts. Anterior is simply the anterior nucleus. Medial is simply the dorsomedial nucleus. And when we talk about the larger lateral part of the gray matter of thalamus, it consists of the dorsal and the ventral tears, which have over here been mentioned as dorsal and ventral groups. The dorsal group consists of the lateral dorsal, the lateral posterior, and pulvinar. These are the three parts of the dorsal group. That was LV and LP and pulvinar, which I drew for you on the whiteboard. The ventral group consists of the ventral anterior nucleus, the ventral lateral nucleus, and then the ventral posterior nucleus, which has these two parts, VPM and VPL. We know that the VPN is the one which processes the sensory information, whereas VA and VL are the ones which are going to process the motor information. Okay, so here is a coronal section now through the brain. And you can see over here that this here is the dorsomedial nucleus of the thalamus. These are the paired thalami, right? So they are two in number, one on either side of this third ventricle present in the midline. So looking at the thalamus of one side, we see the dorsomedial nucleus and the internal medullary lamina. Then out lateral to that is the lateral dorsal nucleus of thalamus, and outer to that is the external medullary lamina, and then comes the internal capsule, that is the posterior limb of the internal capsule. So what are the key points if we want to summarize the connections of the thalamus? So topographic information to the cerebral cortex is first processed in the thalamus as follows. The DML and anterior groups from the limbic system, the ventral tear nuclei from sensory and motor systems, the dorsal tear nuclei from the other thalamic nuclei as well as limbic system, intralaminar midline nuclear groups from the brainstem reticular formation. The thalamic reticular nucleus, remember, is unique because it does not send projection fibers to the cerebral cortex, but it samples the neural activity passing between the cerebral cortex and the thalamic nuclei, serving as the gateway to the cerebral cortex. This here is a summary in tabular form where you can see these are the thalamic nuclei and these are the specific connections, the input and the output connections, which I mentioned as I was drawing the connections of and mentioning the connections of the thalamus on the whiteboard for you. Now, what are thalamic radiations? Well, you see the information as it is projected to the cerebral cortex is going to be in the form of different collection of fibers, which are known as the radiations. So those which are going to the frontal lobe are simply known as anterior thalamic radiation. Those going to parietal lobe are the superior thalamic radiation. Those fibers, that information going to the occipital lobe is known as the posterior thalamic radiation, whereas those going to the temporal lobe are the inferior thalamic radiation. Now, anatomically and functionally, remember the thalamus and the cerebral cortex are very closely linked. If there is removal of the cortex, remember the thalamus can still appreciate crude sensations. The cerebral cortex is required for the interpretation of sensations based on past experiences. Now, an example of this would be that if the cerebral cortex is removed, but the thalamus is still present and a hot object is placed in the hand of a person, the person can perceive that an object has been placed in their hand, but the size of the object, the temperature of the object, these details cannot be perceived by the person because the cerebral cortex has been removed. So crude perception is there, but the interpretation of that sensation is not present. Now we're going to discuss the thalamic lesions, a few of the lesions which are the common and important ones. Now, why is the thalamus so important even when we are talking about the clinical presentations? Remember, the thalamus is a relay station and it's an integration center for information passing to neocortex as well as other parts of the brain. So a lesion or disease of the thalamus will have profound effects. And how can it be damaged? It can be damaged by tumor or infarct after arterial thrombosis or hemorrhage. Now, the Korsakoff syndrome, this is a syndrome which occurs in thiamine deficiency in alcoholics, and it leads to degeneration of the anterior and dorsomedial nuclei of the thalamus and the mammillary bodies, the hippocampus, and the vermis of the cerebellum. It's a chronic condition. It affects memory storage due to the involvement of the Papez circuit of the limbic system. And the type of loss, the type of memory loss is a short-term memory loss, which means that there is going to be difficulty in creating new memories and the memory of recent events will be lost. Another condition which is related to the thalamus is the thalamic pain syndrome, also known as Dejerine-Roussy syndrome. In this case, there is involvement of the VPL nucleus, that is the ventroposterolateral nucleus, due to vascular occlusion of thalamo-geniculate branch of the posterior cerebral artery. And this leads to an increased sensitivity to pain. That is known as the thalamic overreaction, as well as hemianesthesia, that is loss of sensations on half of the body, but that would be the opposite half of the body. And there could also be painful anesthesia. So the thalamic pain, this is also called the central pain, is a sort of pain which is a burning pain. It is often an excessive pain, and it might be triggered by a very light stimulus of touch or cold. And this sort of pain is going to be resistant to treatment by the typical analgesic medications. So this pain is known as the thalamic pain. And this syndrome can also include other presentations such as temporary hemiparesis, which would be due to involvement of the internal capsule, and it could also be because of the involvement of the basal ganglia. Chorioathetosis with hemiataxia, that is due to loss of muscle joint sense, and also homonymous hemianopia due to involvement of the lateral geniculate body. These are also the different signs and symptoms which might be involved in the thalamic pain syndrome. Now that we've covered the basic aspects, the basic anatomy of the thalamus, it should be easy for you to figure out the answer to this MCQ. Most sensory nuclei of the thalamus, they project to, well, of course, it is the cortex. The following nucleus forms a shell-like structure on the anterolateral surface of the thalamus. Well, that is the reticular nucleus. So this concludes with today's discussion on the neuroanatomy of the thalamus, in which I covered the basic aspects of the functions, nuclei, and connections of thalamus, and mentioned a few of the thalamic syndromes. And I hope this was easy for you, and it was comprehensive enough, and you got the gist of it. And please, if you like this discussion, then don't forget to like and subscribe to my YouTube channel, AnatomyMentor. And you can simply do that by clicking on my picture, which is going to appear at the end of this video. And also don't forget to press the bell icon so you can be notified of my recent uploads. So thank you and enjoy your studying. Stay happy, stay sharp. Take care. God bless.